Now, so this is the antigenic shifting and drifting which you observe up. Okay, this is the antigenic shifting and drifting. Which one is big, guys? Shift or drift? So drift is less stuff and shift is big thing. That is abrupt, drastic, and discontinuous. That is shifting, and drifting is single continuous mutations. Okay, so this is there, and this shifting leads to pandemics, and this drifting leads to what? Like endemics ones. We later on add to the epidemics also. Okay, another hot favorite question of examiner is this one: molluscum contagiosum, pearly white. Okay, pearly white or pinkish white umbilicated nodule done by this MCV1 and MCV2 associates with HIV positive one. That also there, and this is the inclusion body of that. And down, if you up, you can see this. This is a typical structural electron microscope of the bacteriophage. Okay, having all the head, having the tail, having the collars and core, everything. Like if all they give a picture now, what are the bacteriophage? This looks like a bacteriophage. Okay, and what is bacteriophage actually? The viruses which eats the bacteria. On the basis of which what you do, that you do the bacteriophage typing and all. Okay, so guys, molluscum contagiosum is a damn sure question you are getting in the exam. And besides that, which I told up, that particular herpes simplex stuff that is there, all those Epstein-Barr virus important, CMV important, so they all are coming in the exam. You need to focus upon. Besides that, another important unilateral bilateral parotitis. It's a common phenomenon seen in bums that also need to focus upon. Okay, so this is there. This particular one is there. It presents up, and what is the atypical presentation? Meningoencephalitis sometimes happens, which precedes a parotitis, and this can cause in the young males and females. In young males, it can bronchitis, in females, it can ophritis, and overall aseptic meningitis also associates with this particular mumps. Okay, and which is the vaccine strain used? Zerilin. And what is investigation of choice? PCR. Nowadays, PCR. Complex spot. Pathognomic feature of what? Measles. Measles, what you call in Hindi? Khasra. Okay, so that also needs to focus upon. And besides that, it is seen opposite upper second molar or lower? It is lower second molar. You see the complex spot. And what is the infectivity period, guys? Rash 4 days before, 5 days after. Okay, and this is from Nelson. Besides that, you can remember a lot of questions regarding this measles. That is Warden Finkley giant cells that is present. Okay, SSP happens to be a chronic late complication of it. Okay, otitis media happens here. Pneumonia is there. One pneumonia is termed as HS pneumonia, which is there in the HIV positive individuals. Okay, the children which have HIV positive, they develop this Hatchett's pneumonia, giant cell pneumonia, we call it. Okay, besides that, these all names which I have told you, and that the secondary attack rate of this is more than 90%. Okay, more than 90%. That is there. Incubation period can also be a question. Most of them with rashes around. Most of them with rash, they have having 2 to 3 weeks, and this particular one 10 to 14 days. Fine, this is having around 10 to 14 days. Now down you can see the cataracts to what? Due to the congenital rubella syndrome. And what is the triad, guys? The cataract, heart disease, and deafness, sensorineural deafness. And in the heart disease, PDA is the most common, and cataract is, this is a classical triad which is observed in the congenital rubella one. And if for the measles somebody asks you regarding the vaccine, that is Edmiston Jagrov, and here it is R827/3. Okay. Now another question which is being asked is this particular one, the four-chemered spots. The four-chemered spots are observed in, that is observed in the rubella. Okay, blueberry muffin rash is also a feature of this particular one. And the infectivity, what you say, that infectivity period is rash 7 days before, 7 days after. So that particular thing is seen in rubella also. Now, other than that, if you focus upon the rabies one, the rabies is a negative sense RNA virus. Which important? Another one is negative sense influenza. Influenza is also a negative sense virus. Okay. Besides that, it is bullet shape, and the speed is what? 3 mm per hour, at which it's travels upon. And the question which have come last time is which particular state or which particular place is not having the rabies. So that is Lakshadweep, and even Andaman Nicobar they say, and they don't have the rabies stuff. And which state is aggressive against rabies? That is Goa. Okay, so that is there, and this is a negative sense RNA virus, 3 mm/h the speed. And two types of viruses are there. One is a street virus, one is a fixed virus. Fixed virus is used for the vaccination stuff. And what is the pre-exposure prophylaxis? 0714, 0721. And besides that, the post exposure prophylaxis 037 14 28. Okay, 037 14 28. That is the post exposure prophylaxis. Confusion is there in that, but still. And in the re-exposure one, if a rebite happens, so up to 3 months nothing, and after that 0.3. So that is also there. And what is pathognomic here? Pathognomic is finding of the Negri bodies, which are like intracytoplasmic inclusion bodies, eosinophilic. Fine. So that is also important. And for which particular biopsy you go for the nape of the neck tissue biopsy, and you can go for the DFAT, direct fluorescent antibody testing, or antigen testing can also be done. Besides that, in the rabies, guys, a lot of questions can come regarding the bite stuff. That is, what is the classification of various types of bites? The class 1 bite, class 2 bite, class 3 bite. Okay, so that is there that you can find. Besides that, you can have in the class 3 bites, which type of thing you have to do, because that is there is a constant oozing of blood there. So you have to wash it first, and then you have to immediately put up what that rabies immunoglobulin, and after that post exposure prophylaxis you have to give in that particular one. Okay. And the question can come regarding the immunoglobulin also. The equine one is 40 international 40 units per kilogram, and that human one is around, guys, 20. Fine. So all these you needs to focus upon to answer up the questions in the exam. Now another important stuff, that is the Japanese encephalitis, which you can observe here. Okay, in this particular picture, Japanese encephalitis. So as the guys, the name of the mosquito is being already written up, Culex vishnoi or Tritonorinicus, that is there. Okay, in India it is vishnoi. And as you can see, these added birds, that is cranes and all, the pigs are the amplifiers here. Okay, so this particular triad is observed up in this particular Japanese encephalitis, having a mortality of how much? That is more than 30%. Okay, 30% mortality is there in this particular one. More than 70 is there in what, guys? That is in the Nipah. Okay, so actually it is not more than 70, it's around 50, 50 to 70, that range is there. And Nipah belongs to which particular family, if somebody asks you? That is the Paramyxoviridae. And what is the subfamily? Hanipa. So Nipah is Hanipa. And RSV belongs to this. RSV does acute bronchiolitis, and the treatment of choice is like ribavirin. And besides that, croup was a question of your FMG exam, that is acute laryngotracheal bronchitis, and that is being done by parainfluenza 1 and 2 mostly. And mumps, measles, we have already discussed up what questions can come, rubella, what all questions can come regarding them. So that is there. They can show you the picture also. They can tilt you off to regarding the congenital rubella and all that, and they can ask the various stuffs. Okay. Regarding the structure of the rabies, this is the typical structure of the rabies, and you know that the three important structural genes, GAG and AB and POL. So POL for polymerase, envelope, ENV, and this GAG codes for capsid and core, and capsid is P24, and this particular one, matrix protein, also this code with GAG, that is P17 and 18, and this is the typical structure of the HIV virus, which is observed up. Okay, and guys, there was a question in the last time of MG that somebody have got a needle stick injury, and how much is the chance? First of all, 0.33%. Okay, 0.3%, and some books write 0.5 to 1 also. Okay, so that is there. And which is the first test to be done? That is P24. Okay, which is the best test to be done in the starting? Actually, now that question is a slight bit confusing, and if they have asked up that which is the first test which can come positive, answer is P24. If the option PCR not there, because PCR can come positive very soon, but as far as the antibodies are concerned, they take around 3 weeks to come, and that particular period only is termed as what, window period, in which the antibodies you can't detect. Okay. So that is there, but you want a early diagnosis, and if it is written up in the PCR, that is HIV RNA PCR there, the answer is that. Okay, and if it is written P24, then answer is that. After that only you go for this ELISA and all. Okay, so this that was the answer to that particular question regarding the HIV stuff. Otherwise, in India, that mostly the sexual transmission happens, and the per episode is more in the blood transfusion stuff. Okay.